Today's focus is on Asia.
Today, the spotlight is on Africa.
Thank you for joining the third and final day of an incredible fourth annual Women Leaders Global Health Conference.
COVID has actually made the challenges of achieving gender equality even harder.
But often health is the place where a lot of those inequities intersect.
Absolutely. I couldn't agree more. We definitely need more women representation in every sphere and in every tier.
I do feel that when there is policy making about women, let's go back to the Beijing conference now, it's 25 years. What are we really seeing which we wanted to see in 25 years? Yes, there will be progress, there always is, but is it what we expected?
With the James P. Grant School of Public Health, we were set up by BRAC, the NGO, but we're an independent academic institution. And what we found is many of the community health workers are extremely committed.
I think the irony of my answer is the fact that we've had to hold a conference of sort of foregrounding women leadership in global health at a time when some of the best reportage on this pandemic, not just in India and South Asia, but across the world, has come from women journalists. When women leaders in 7 to 8 countries have been at the forefront of nations that have performed better or handled the pandemic in a better manner.
Sometimes we blame ourselves for the positions we find ourselves in. So one of the first things I do is there are other people who are also going through this. You're not alone.
Why can't trans people access those services? At the end of the day, we are seeking equality. We are not seeking special rights.
Every life needs an opportunity. Every life needs someone to believe in them.
The issues that have been traditionally labeled women's issues are actually societal issues. And I would like to see more men advocating for women's dignity and safety, as well as women's participation in leadership and decision making.
We don't need to fix women, women don't need to be fixed. So for us as allies, we need to work together with women to fix the barriers actively. Leaning out means giving up power.
At the same time, I think it's important to differentiate between women and women's experiences. White women, women of color, Black women, lesbian, we all have very different experiences. And so we have to kind of unpack what we mean by women's leadership.
You actually have to have enabling policies that make this possible. So for example, how you hire, how do you promote diversity, equity and inclusion in your hiring, in your retention, in your promotion, in your recognition.
Keep gender and diversity at the forefront of your mind as the rebuilding happens.
What we need is inspiring feminist leadership. That's the only way forward.
The future is female, the future is young, the future is digital, and that's why I'm here with all of you.